Let's jump right in. When most people hear the phrase physical therapy, they kind of just picture someone doing, I don't know, a few basic stretches in a hospital bed right after surgery, right? But honestly, that image barely scratches the surface. In this explainer, we're going to reframe physical therapy completely. It is actually a highly specialized medical profession. It acts as this vital bridge between traditional medicine and kinesiology, which is the study of human movement. So let's dive right into this and unpack the mechanics of how we heal, move, and, well, thrive. To really set the stakes here, I want you to think about this quote from Dr. Robert Butler. He said if exercise could be packed into a pill, it would be this single most widely prescribed and beneficial medicine in the nation. Wow, that magic pill metaphor, it's powerful. It hits the nail on the head because it highlights the immense, almost unbelievable value of using movement as actual medicine. Physical therapists are essentially the pharmacists of this magic pill, prescribing targeted movements to treat a huge array of ailments. So here's our roadmap for today. First, we'll define physical therapy. Then we'll look inside the PT toolkit. Third, we're covering mobility versus flexibility. Fourth, balance, stability, and posture. And finally, number 5, PTs versus fitness trainers. Let's get to it. Section 1, defining physical therapy beyond the hospital realm. So what exactly is a modern physical therapist? Well, they are licensed healthcare providers. In the U.S., this actually requires a doctorate in physical therapy, a DPT, along with passing some pretty strict national and state certification exams. They evaluate, they treat, and they educate patients, helping people recover from everything from, say, a minor ankle sprain to traumatic car crashes or strokes. But the really key takeaway here is that they treat disease or injury using physical means. We're talking functional movement, hands-on manual therapy, and temperature control, rather than relying on pharmaceutical drugs or going under the knife. They are the ultimate crossover point between the medical doctor who gives the diagnosis and the kinesiologist who understands exactly how the body actually moves. And what's really fascinating is just how far back this discipline goes. This is definitely not some modern fad. Back in ancient Greece, Hippocrates was literally already using massage and hydrotherapy to treat patients. Fast forward to 1813, and Per Henrik Ling established the very first formal physical therapy school over in Sweden. Then in the US, the profession just absolutely boomed after World War I. Why? Well, they needed to rehabilitate wounded soldiers coming home. This massive need for structured physical recovery led directly to the American Physical Therapy Association being established in 1921, which formally recognized it as an official profession. Section 2. Inside the PT Toolkit. Ordinary objects, extraordinary results. Now, if you walk into a modern physical therapy office today, honestly, it often looks way more like a local gym than a sterile hospital room. But the way PTs use standard gym equipment is highly specific and very clinical. For instance, they'll use lighter free weights, but focus heavily on unilateral or single-sided movements just to recuperate lost strength on one specific side. And you know those large inflated yoga balls? They don't just use them to sit on. They use them to purposely create instability, which totally forces your body's core and pelvic floor to wake up and engage. And resistance bands? They act like giant rubber bands that provide variable tension across a specific movement. They're basically a brilliant, lightweight tool for applying just the right amount of pressure while you're recovering from an injury. Another incredible tool you'll often see hanging around are suspension trainers. You might know them by brands like TRX. These are those long, adjustable fabric straps anchored high up on a wall. What makes these so absolutely vital for rehab is that they offer a super controlled way to modify or progress movements using strictly your own body weight. They let a patient support themselves and control their exact range of motion, completely avoiding the burden, or the danger, really, of holding heavy, cumbersome iron weights. But here's the thing, a really great PT doesn't even need specialized gym gear to fix complex issues, and this brilliantly illustrates how resourceful the profession is. Let's talk about treating plantar fasciitis. That's a super painful inflammation of the connective tissue on the bottom of your foot. A resourceful physical therapist will prescribe an exercise using just a simple household towel. Yep, you just place the towel on the floor and slowly pull it under your foot by grabbing and curling your toes. That one simple motion strengthens the foot and effectively treats the inflammation using something you literally have sitting in your bathroom right now. How cool is that? Section 3. Mobility versus flexibility. The crucial distinction. Okay, so this is a crucial point. People mix these up all the time, but while they're related, they are absolutely not the same thing. Flexibility is all about your muscle tissue passively lengthening. Think about someone bending forward to touch their toes. If they can do it, that just shows they have highly flexible hamstring muscles. Mobility, on the other hand, is about the joint itself. It's the ability of a joint to move through its full normal range of motion. So you could actually have very flexible muscles, but if a joint is limited by swelling or a past injury or pain, well, you have poor mobility. And improving both of these is absolutely essential as we get older to maintain normal, healthy function. Section 4. Balance, stability, and posture, the mechanics of upright movement. We totally take this for granted, but moving around predominantly on two legs is a massive anatomical challenge. Humans, along with birds and maybe a few apes, are the only animals that walk upright bipedally. Clinically speaking, balance is the ability to move under control and maintain that upright posture. It requires this constant split-second feedback loop from your body to your brain. If a patient has a neurological issue, like a stroke or a musculoskeletal injury, it can completely disrupt their balance. And suddenly, that seemingly simple, everyday task of just walking, it becomes virtually impossible. To train this, PTs use a whole spectrum of balance exercises. I want you to mentally test yourself against this difficulty scale right now. Level 1 is simple enough. Just stand on one foot with your eyes open. But close your eyes, which removes your visual anchor, and you immediately hit level 2, which is significantly harder. Moving all the way up to level 7, we've got walking heel to toe in a straight line. And then all the way at level 10, maximum difficulty, is the pistol squat. That's a one-legged squat that requires just an immense amount of balance, mobility, and strength. Think about where you might fall on this scale today and just how much physical control it takes to climb it. Now, closely linked to balance is joint stability. This is a joint's ability to maintain proper alignment and control within its normal range of motion. It relies on a super complex interplay of your bones, ligaments, tendons, and muscles. Let's contrast two joints to really understand this. Your knee is generally a highly stable joint. It can withstand a lot of normal force without moving out of alignment, which prevents cartilage damage. But a joint like your shoulder, it has incredible mobility, but that comes at the cost of stability. If the supporting structures of your shoulder are weakened, it becomes unstable and highly vulnerable to dislocation. When you combine balance and stability, alongside literally dozens of muscles working simultaneously just to keep you from falling over, you get posture. Posture is the anatomically ideal position for your body. Unfortunately for us, modern habits like sitting hunched at a computer desk for 8 hours or constantly looking down at our phones wreak total havoc on this system. Over time, these habits can lead to incorrect bends in the spine. These are classified as kyphosis, lordosis, or scoliosis. And depending on how severe they are, these postural deviations can cause anything from just some mild discomfort to severe life-altering impairment. Section 5. PTs versus fitness trainers. Understanding the hierarchy. A lot of people incorrectly group these professions together, but the distinctions here are vital. Personal trainers. They are amazing professionals who help healthy individuals meet general fitness and exercise goals. Athletic trainers are specialists specifically focused on preventing and managing injuries within athletic and sports environments. But physical therapists, as we've seen throughout this explainer, sit in a different category entirely. They are licensed medical professionals with doctorate-level education. They're specifically trained to treat actual diseases and severe physical injuries, bridging that gap between the medical doctor's diagnosis and the body's functional rehabilitation. As we wrap this explainer up, I want to leave you with a question to really cement what we've covered today. Based on the evolution of the practice, the medical toolkit, and the complex mechanics we just explored, how would you summarize the core differences between personal trainers, athletic trainers, and physical therapists? Understanding who to call and why is the very first step in maximizing the incredible machine that is your body. Keep moving, keep learning, and we'll see you next time.